So we are talking about periorbital rejuvenation by cosmetic surgeries. In this procedures, we have upper eyelid surgeries, the lower eyelid surgeries. You will see a lot of patients I see, a lot of people you will see in society who will have eye bags, loose extra skin in your lower eyelid, as well as loose upper eyelid extra skin, which causes drooping of upper eyelids. Now to correct this, we need to remove the extra skin and the fat or eye bags if they are also there. So for lower eyelid, there are two ways to do this surgery. Either you can give an incision or a cut along the eyelash so that the scar is never visible, or you can invert the eyelid and go from inside. What we do is we take out the fat, whichever is there, extra fat is taken out. Along with that, we can also tighten the skin so that you get a lift of the midface as well. For upper eyelid, we give an incision in your eyelid groove. So each of us, when we open the eyes, there is a groove. So we get an incision inside it so that the scar is never visible. We take out the extra skin and if needed some extra fat as well, and then close it with a very fine sutures. Now after both of these surgeries, you will have some swelling and bruising for 7 to 10 days. So you are slightly socially restricted. You don't have too much of pain, and in fact patients don't complain of pain. There's just a bit of discomfort because of some tightness, which is taken care of by diclofenac tablet. No stronger painkillers are also needed. And after 7 to 10 days, once the bruising and the swelling is settling down, you can appreciate the result much better, and this procedure results cannot be matched by any non-surgical modality of periorbital rejuvenation.
Hello, my name is David and I'm from London, and I've come to Skinovations to Dr. Gupta to have some work on my upper eyelid and the area below the eye also. The operation was done 7 weeks ago and some photographs were taken at that time. I've been travelling in India and I've just returned to Delhi, and so Dr. Gupta has had an opportunity to look at the results, which I think are excellent, and I'm really delighted with the work that he's done.